Every single family in Mesa County is impacted in some way with the need for basic foundational services and behavioral health services. So without getting access to those foundational services, people tend to need emergency services over time. And so how do we ensure that everyone has food, that everyone has the shelter that they need, making sure they have just those Maslow's hierarchy of needs, right? How do we ensure everyone has what they need in order to sustain? And then from there, we work on behavioral health. So I'd like to start by saying that we are an organization that has come about because Mesa County has changed over the last few years. There has been a bigger need in behavioral health than we've ever seen before. The gaps in services and lack of communication across providers that do really intense, wonderful work, the siloing of that has made it impossible for our individuals in the community to know where to go to get access to service. And so we thought it would be a great idea to start trying to figure out how to collaborate, how to get people to come to a table, start having conversations, start discussing this behavioral health issue, this complex, very tough, multifaceted issue in a way that we could all start trying to create a solution. So Mesa County's been doing it in different ways for a long time. They just haven't had a team that now can make those connections and understand how to speak that language, understand the resources in the community, and how to connect people correctly to the right resources. Mesa County Behavioral Health does not do any direct care service outside of our co-response team. One of our big passions has been connecting organizations who do similar work to make sure there's no duplication of service, making sure that when we build a capacity for, say, 400 intensive case management services in the community, that we know that those are for individual people and not duplications. That will make the biggest impact. And so far over the last 2 years, that's what we've been working toward. Behavioral health started as a way to support the most vulnerable. And in that population really we identified as being the ones that we see most often in our ER, our hospital ERs, in our psych hospital, in our jails that shouldn't be there. Low criminogenic factors, high mental health, high substance use, that just seem to be without hope and without help. We started there. That of course started with MAC and our multi-agency collaboration, going and finding organizations that were doing the work at a smaller capacity, helping to find funding to build out their capacity so that they can help more people. The goal is not to be a competitive organization with organizations in the community that are already doing the work. Our job has been to look at the community and see the organizations who've been offering those services, maybe at a small capacity, limited ability. Our job is to say, what do you need? In order to get bigger, to get better, to provide the most amount of service for the people who need it, what do you need and how can we support that? We don't duplicate any service. We don't go in and say we know more than you. We say, can we walk alongside you? Can we create something with you that has a bigger impact? And say, what do you need in order to do it on a bigger scale? So then we go and help to look for funding. We help to add to that through education, help them in case they encounter barriers, give them whatever resources that they need to continue to grow. And then on the other side of that, we watch for individuals in the community who need that service and make sure we match them to them. It's been exciting to watch. It's very exciting to see the organizations as they grow and the trust that they've instilled in us to work with them, work with each other. The work that I've been the most proud of is the stuff that we do behind the scenes that no one actually ever sees. Creating the multi-agency collaboration. We personally, Mesa County Behavioral Health doesn't do any of the direct care work, but we found 4 organizations in the community that come together to do that work. And then we created the software system and the single point entry system for St. Mary's and Community Hospital and Family Health West, Mine Springs, West Springs Hospital, the jail, to say, all right, I need help. And they make a single request into our system that then funnels out to organizations that do that intensive work. So again, we put together that structure, but we don't do the direct work because the goal is that we're not competing, we're walking alongside organizations as they grow to make sure they have the support they need, the funding they need. We go out looking for funding to funnel to those organizations. We're not competing against them for funding. Many times organizations need a government entity to make a bigger impact on a grant. And so we walk alongside them to support that. That's our role. The work of behavioral health, it is a necessity in creating a healthy community. I say that's where we fit. And Mesa County that's been our goal ever since we started 2 years ago, is to work with the population, the community, on finding and connecting to services.